Good evening, everyone. Welcome to this webinar hosted by the IgA Nephropathy Foundation, titled Help Take Control of IgA Nephropathy with Tarpeyo. This webinar is sponsored by Calliditas Therapeutics. We will have a question and answer session at the end. Please put your questions in the chat box, and we will answer them at the end of the presentation. Today, we are excited to introduce you to Dr. Sayna Norouzi. Dr. Norouzi is an assistant professor of medicine and clinical nephrologist at Loma Linda University Medical Center. She completed her fellowship at Baylor College of Medicine in Houston, Texas. She is the founder and director of the Glomerular Disease Clinics in Loma Linda. She is also co-director of online GlomCon Glomerular Diseases Fellowship Program. She has been selected as the Educator of the Year for 3 consecutive years and is a member of Alpha Omega Alpha Medical Honor Society. She has a special interest in glomerular diseases and is involved in multiple research projects and clinical trials. Welcome, Dr. Norouzi.
Well, thank you so much for the kind introduction. I'm really happy to be here. I'm really honored to be here as well. Today we're going to talk about one of the topics that is really, really close to my heart. I have a glomerular disease clinic here on the east side of LA, and I have a huge patient population with IgAN. So this is something that I deal with it on a daily basis. Basically, I do research projects, I see patients with IgAN, I do clinical trials, I prescribe new medications for them, and this is something that is really, really close to my heart. Again, thank you so much for having me today. And today, this is the agenda for today. We're going to talk about IgAN. We want to actually understand why IgA nephropathy is happening in some people. And that's one of the questions that most of my patients, they ask me, why me and why is it happening to me? And then we're going to talk about the new medication that came out, Tarpeyo, and how we can preserve your kidney function. Then we're going to talk about Tarpeyo touch points. And then we have one of our patients here, Katherine, who's going to share her story and her experience with the new medication, Tarpeyo. And after that, I'm going to take questions. I'm going to answer your questions. So I think understanding IgA nephropathy helps a lot, helps physicians, helps patients, because when you are a patient and something happens to you, which is called an autoimmune disease, it sounds scary. And it's not like one of those common diseases that you hear about it all the time. It's not high blood pressure that you've heard that, your family members, they have it, or like your friends, they have it. This is some kind of like an uncommon disease. And you hear the words autoimmune, your immune system is attacking your body. So it sounds scary, but I feel like having a better understanding of what's going on inside your body when you're getting diagnosed with IgAN, it's going to help a lot to navigate your treatment options and to have a better understanding of the disease state as well. So what is IgA nephropathy? It's a progressive autoimmune disease. And by autoimmune disease, I mean that your immune system is attacking your body, meaning that your immune system got activated for some reason. You got an infection that you didn't even think about it. It was a simple infection like a cold, like you were just sneezing for a couple of days, you had a sore throat, and you're now fine. And all of a sudden, your immune system is just not calming down. It's activated and it's attacking your own body because your immune system, it feels like there is something that your immune system wants to remove it, but there is nothing there. And that's the foundation of like whenever we say that it's autoimmune disease, it means that your own immune system is attacking something that is not there and it's just attacking your own body. How does it happen? Like, how does your immune system is affecting your body in the setting of IgAN? Is that in the setting of IgA nephropathy, you are producing a kind of antibodies and antigens that is called IgA1. This IgA1 is not normal and your body doesn't recognize this. So your immune system gets super activated to remove this. And in order to remove this IgA1, you're going to produce a lot of antibodies. So these antibodies and antigens, they're going to fight with each other. So the antibodies are trying to remove IgA1 and they're going to form something that is called an immune complex. This immune complex is really like now a bigger molecule, and now your kidneys, they have special receptors for this kind of immune complexes. So they are circulating in your body and they sit on these special receptors on your kidneys. And once you have these immune complexes sitting on your kidneys, you're going to have more inflammation there because your immune system is going to go after these immune complexes and trying to remove those immune complexes from your kidneys. So you're going to have more inflammation there. And over time, you're going to have irreversible damage because of the fight between your immune system and your kidneys that they're trying to remove these immune complexes. Because of that fight, over time, you have some inflammation, like chronic inflammation there, that over time, it's going to affect your kidney function and you're going to have kidney damage and your kidney function is going to drop over time. How do we diagnose IgA nephropathy? So the thing is that when I have patients that they have symptoms and signs of IgA nephropathy, and I'm suspecting IgA nephropathy, I kind of like in my mind, I feel like, okay, I'm suspecting IgA nephropathy, but I cannot say it for sure until I get the kidney biopsy. And the way that kidney biopsy is done is a procedure as an outpatient. It usually takes 20 minutes or so. They're going to take a sample of your kidney, like a really small piece of one of your kidneys, just one. And then we're going to take a look at that sample under the microscope. And under the microscope, we're going to see this IgA1 that I'm talking about. It's going to light up under the microscope. And this is the way that we can diagnose IgAN. And this is the way that we can tell you that you definitely have IgA nephropathy. And so for that reason, in order to diagnose someone, you're going to need to do the kidney biopsy. So something that is really, really interesting about IgA nephropathy is that we think that, so this is a disease that is affecting my kidney function. So everything should be in the kidneys. But the research shows that there is a relationship between your gut and kidney. And that's super interesting. And this is something that is all these research projects, all these new medications are focusing on the connection between gut and kidney. What is this connection that is everyone is paying attention to it these days? And this is the most interesting fact that we know about IgAN. Is that when I mentioned that we have this production of IgA1 from your immune system, this IgA1 is one of the main sources of the production of IgA1 is your gut. So it's coming from a piece of it's a really specific part of your gut. So your gut is producing IgA1. And because you have a lot of IgA1, your immune system is going to get activated, trying to remove that. You're going to produce antibodies, and then you're going to make those immune complexes. And then those immune complexes are going to sit on your kidneys. So your gut is actually doing something in the setting of IgA nephropathy. And there is this huge connection. There is a strong connection in the setting of IgA nephropathy. So it would be interesting when we are looking at treatment options for IgA nephropathy to see that if we can stop this connection, right? If we can stop this process somewhere, if we can make the gut not to make IgA1, maybe we can stop the process and maybe we can stop the progression of the disease on the kidneys. Because if you're not producing a lot of IgA1, maybe we can solve the problem for IgA nephropathy. So what are the potential signs and symptoms of IgAN? And so when you are getting diagnosed with IgA nephropathy and someone tells you that you have a specific disease on your kidneys that is called IgA nephropathy, it is an autoimmune disease and you're producing a lot of IgA1. So you feel like, okay, so how is it going to affect my life? And then you think about your own symptoms. A lot of my patients, they mention that they've seen blood in their urine at some point. But if you haven't seen blood in your urine, it doesn't mean that you do not have IgA nephropathy, because the type of blood that we see in the urine, sometimes it's only we can see it under the microscope. So you're not able to see it, like when you're trying to pee, like you look at your urine, so like it looks normal to me. But then you go to your doctor, you go to your nephrologist and so like you have blood in your urine. Because the type of blood that we see in the setting of IgA nephropathy, sometimes is only the type that we can see it under the microscope. And then your urine might be a bit foamy. And the foam that we are talking about is that when you're trying to flush, the foam is going to stay. It's kind of sticky and it's not going to go away. And that's the protein in your urine that is looking like bubbles, like sticky bubbles there. You might have some swelling on your legs and you might have some lower back pain as well. By the time that you are getting diagnosed by IgA nephropathy, most of the times you have some kidney damage on your kidneys. And this is unfortunately something that we see in the setting of in the United States, because we do less biopsies when you compare that to Asian countries. And a lot of my patients, when they come to clinic and I tell them that, okay, we have to do the kidney biopsy, we see that they have CKD stage 2 or 3, meaning that they have chronic kidney disease stage 2 or 3, meaning that they already had some damage done to their kidneys at that time. So how do I monitor my patients with IgA nephropathy? When you get diagnosed with IgA nephropathy, I'm sure that there are a lot of things that comes to your mind. How can I preserve my kidney function? How can I treat this situation, this IgAN? What are the medications out there? And what's going to happen from now on every time that I come to my doctor? Like, am I going to do blood works? Am I going to repeat my kidney biopsies? What's going to happen to me? And those are all really good questions. I always try to have like a really long visit with my patients and tell them about everything that's going to happen from now on, because I feel like it's going to come with a lot of anxiety when you don't know what's going to happen at the next visit. There are two things that I'm going to look at your labs when you come back for the next visit. I'm not going to repeat the kidney biopsy. We usually diagnose a patient with IgA nephropathy with only one time the kidney biopsy. And from once you're done with your kidney biopsy and you got diagnosed with IgA nephropathy, from now on, you're going to do blood works and urine tests. We're going to do blood works and we're going to check something that is called estimated GFR. And that GFR is going to show your kidney function. So the higher GFR is better number. So we want to see high GFRs, and the number ranges between 0 to 120. And for example, if your number is more than 100, that's amazing. That's normal. If your number is dropping, like your GFR, every time that you come to the visit and your GFR is dropping from 100 to 90, then 80, it means that you're like having more of a kidney disease, and your chronic kidney disease is actually getting worse. And then we check something on your urine sample. It means it says UPCR, and it means urine protein to creatinine ratio, meaning that foam, those bubbles, those sticky bubbles, I want to measure them and see how much protein you have in your urine. Because the more protein that you have in your urine, it means that you have more aggressive type of IgA nephropathy, and you need more treatment for it, and you're at risk of losing your kidney function much faster. So basically, we do not want to see any protein in the urine. So basically, we should see zero protein. It should be zero. So any amount of protein in your urine is not normal. And as long as this number is going up, this UPCR is going up, it means that your IgAN is not under control, and we have to think about something. We have to add like a new medication to it. We have to do something about it. As long as you have UPCR, a positive UPCR, and you have a lot of protein, it means that your disease is super active. But you know what? One thing about kidney disease is that once the damage is done, we're not able to reverse that. So all the things that we do in the setting of kidney disease, we actually want to prevent that kind of a damage. So when you come to me, I say like, I want to start a treatment as soon as possible, because once the damage is done, I'm not able to reverse that, but I want to prevent that. So everything about kidney disease is to prevent the kidney damage, not to reverse that. So for example, if you come to my clinic and you already have some degree of chronic kidney disease, no one can fix that. But if you come early and we diagnose you early, we can prevent that damage. And that's the key about IgA nephropathy, that we want to diagnose you. We want to do the kidney biopsy as soon as possible. We want to diagnose you as soon as possible so we can prevent a chronic kidney disease for you. So, but how can we preserve your kidney function? I'm going to talk about a new medication today, as we all know, and the medication is called Tarpeyo. Tarpeyo is the first and only FDA-approved treatment that is proven to reduce the loss of kidney function in patients with IgA nephropathy. And it's been studied in adult patients, so we don't have data in children yet. But what is Tarpeyo? Tarpeyo is a capsule that you take it in the morning, and it's a prescription medication. So you have to go to your nephrologist and they're going to prescribe the medication for you. And the way that Tarpeyo works is that it's a targeted release capsule. It doesn't get released until it gets to that point on your gut, the point that is making a lot of IgA1, and sits there. Once it gets to the certain level, like once it sits on a certain receptors and it gets to a certain pH, this capsule is going to get opened up and it starts working there. So it's like a really amazing technology. Like as a physician, I really get excited about new medications. And when I hear that it's targeted release and it doesn't get released as soon as you swallow the capsule, it sounds exciting to me, because as a physician, I want to use targeted release medications for my patients, a medication that doesn't get released as soon as you take the medication, because then the side effects is going to be much higher then you compare that to a medication that doesn't get opened and doesn't work until it gets to the point that it should work. So that's like an interesting technology that we have with Tarpeyo. And these specific cells in your guts, they are already super activated and they are already making a lot of abnormal IgA1. So this capsule is gonna go until it gets to that certain level in your gut. It's gonna sit there, it's gonna get opened up, and it's gonna decrease the production of this kind of abnormal IgA1 that you are making. So from the pathophysiology standpoint, it makes sense because, you know, as I said, like in the setting of IgA nephropathy, you are making a lot of IgA1 from your gut. And this medication doesn't get opened until it gets to the gut. It gets opened there, sits there, and it's going to decrease the production of IgA1. So hopefully it can stop the process of IgA nephropathy, because if you're not producing a lot of IgA1, you're not going to make the immune complexes. And then the immune complexes, they're not going to sit on your kidneys. So it makes sense that this medication should be able to stop the process of IgA nephropathy disease. So, but how do we know that Tarpeyo works? So the way that in medicine we do research on new medications is that we do clinical trials. And clinical trials, it means that we have patients that they've been diagnosed with IgA nephropathy. We talk to them about this new medication that sounds promising and if they want to go into a clinical trial. So we have patients that they sign up to go into a clinical trial and they receive the study medication for like 9 months in this study, and they agree to get followed up for 2 years. So for Tarpeyo, we had 364 patients entered to this study. And these patients, they get divided in 2 groups. One group, they receive Tarpeyo, and the other group, they only receive sugar pill, like a placebo. So because we want to compare, the group of patients who are receiving Tarpeyo to patients that they did not receive Tarpeyo and see that if actually Tarpeyo is gonna work for IgA nephropathy. So these patients, they took the medication, they took the capsules for 9 months, and none of the patients, they don't know if they are taking Tarpeyo or they're taking the sugar pill or they're taking the placebo. So they have no idea. The physician who's treating them, they have no idea if they're receiving Tarpeyo or not. But in the background, they're receiving the blood pressure medication, which is known to help IgA nephropathy as well. So all of them are taking the blood pressure medication, but some of them are receiving Tarpeyo for 9 months. So during this time, we're going to check their eGFR and we're going to check the amount of protein they have in their urine. And then we're going to see if the patients who are receiving Tarpeyo, if they're going to do better at the end. So this study, they actually followed these patients for a total of 2 years. For 9 months, they were taking the medications. And then after that, everyone stopped taking the medications, but they continued to follow up the patients for 15 months because we wanted to see that if you finish the treatment with Tarpeyo, are you going to see the effects of Tarpeyo after finishing the treatment for a couple of months after that or not? Is it going to preserve your kidney function for a longer time or not? So that's the reason that they followed patients for 2 years to see if actually Tarpeyo works in the setting of IgA nephropathy. Okay, so here are the results. So basically, they did the blood works and urine tests on these patients depending on the research protocol that they had. But over the 2 years, they had many data from these patients, and they compared the kidney function from the group that they received Tarpeyo, compared that to the patients that they only received the blood pressure medications. And as you see, this is the eGFR data. And patients who received Tarpeyo, they had less reduction in their kidney function over 2 years. So for example, patients who did not receive Tarpeyo, they had a reduction about 11.2 points in their kidney function, comparing to patients who received Tarpeyo, which was 5.3. And then they do the statistical analysis between these 2 numbers, and it was significant, obviously. It shows that if you're taking Tarpeyo, it's going to preserve your kidney function, at least over 2 years that we're having the data for it. So this is something that sounds promising as a physician. You know, I'm a nephrologist, I'm a kidney doctor. When you come to my office, in my mind, I want to preserve your kidney function. I don't want my patients to end up on dialysis. I don't want that, you know, like to follow you up and say that, oh, by the way, you need transplant. I want to do everything that I can to preserve your kidney function so you do not end up on dialysis or you do not need transplant at the end. And this data sounds promising to me because, you know, I see that patients who received Tarpeyo, they had less reduction. So this is something that shows that actually patients who are taking Tarpeyo, they had less than 50, like, you know, you had more than 50% reduction, decline in the kidney function versus patients who received blood pressure medications alone. So this is something huge, you know, more than 50% reduction if you're not taking Tarpeyo. And then, you know what, they compared the UPCR. So UPCR is the amount of protein that kind of like, you know, bubbles, the sticky bubbles that you see in your urine, on the protein that you see in your urine. And they compared that between patients who were receiving Tarpeyo and the patients who did not receive Tarpeyo over to 9 months. And as you see, the protein was reduced significantly in the group that they received Tarpeyo, 34% comparing to 4%. So again, as I said in the beginning, if you have more protein in your urine, it means that IgA nephropathy is going to affect your kidney function over time. And if we can reduce the amount of protein in your urine with any medications out there, it means success to us. These are the numbers that I follow in the clinic when you come with IgA nephropathy. And if I see that the urine protein is going down, it's actually such a good sign, and it makes both of us happy. I was like, okay, this is such a good sign that it sounds like you're responding to the medication and you have less protein in your urine. And it's just not about the UPCR. This is something that we can actually calculate that from your urine. The less protein that you have in your urine, you're going to have less edema. You're going to feel better. You're going to have more energy because your disease is less active. And these are the things that you cannot measure in a clinical trial study. This is something that comes from the patient side, that I see that my patients are doing better because their numbers are getting better, and sounds like it's controlling the disease. So when did patients start to see results? So this is something that happens in my clinic. So whenever I start Tarpeyo for my patients, we both are excited and so like, okay, when should we check your labs next time to see that if you're responding to the medication? So during the clinical trial, we had, they followed up on the patients. And basically, we should be patient with the medication. You're going to see the results around like 3 to 4 months after starting the medication. So I usually tell my patients once I start the new medication, Tarpeyo, I say like, I'm going to see you back in 2 months just because I want to make sure that you're tolerating the medication well. We're going to check your blood pressure. We're going to talk about like your new medication. I want to make sure that you don't have any issues, but we're going to check your blood test and your urine test in 4 months because, you know, I know that the medication takes time to work, and I don't want to check numbers when I know that it's too early to check. In this clinical trial, Tarpeyo was studied for a 2-year clinical trial, and it included 9 months of Tarpeyo treatment plus the prescribed blood pressure medications. But the fact is really important that you need to stay on Tarpeyo for at least 9 months, you know, to complete the treatment course. It's not like you can take it on and off or take it for 5 months and then stop it. You want to take your medication for the full 9 months to have the full benefits of the medication. Otherwise, if you take it on and off, then you might not see the full benefits. It's the same as the same medications. If you're not taking your blood pressure medications every day, you're not going to have a good control on your blood pressure. If you're not taking your diabetes medications every day, you're not going to see the full benefits of the medications as well. So the same thing, once we start the medication, we have to take it every day, and then we're going to check your labs first time in 3 to 4 months to see if you're responding. What are the safety profile of the Tarpeyo? Tarpeyo is generally well tolerated. There are some side effects that it was reported from the clinical trial. Some of the most common side effects are swelling on the legs. Your blood pressure might go up during the treatment with Tarpeyo, but the amount of high blood pressure that we're gonna see, like the amount of increase in your blood pressure, is not gonna be super significant. And then you're going to have some muscle spasms. You might see some acne, headaches. We always tell our patients your immune system might be a bit suppressed, so you have to be careful about upper respiratory tract infections. Your weight might be increasing. So the median increased weight during the clinical trial was about 2.2 pounds. So it's not a lot when you compare that to systemic corticosteroids, which is something that I try not to do for my patients as much as possible. And usually at the end of the treatment, you're going to be able to lose the weight. First of all, it's not that much of a weight, it's about 2 pounds. And then usually like it goes back once you stop the treatment. You might have some indigestion, you might have some inflammation of the skin, some joint pain, and then increased white blood cell counts. But it doesn't mean, like, for example, when we check your CBC, we might see that your WBCs are increasing, but it doesn't mean that you have an infection. It just could be a side effect of the medication, and we don't have to do anything about it. We're just going to monitor those numbers. But before taking any medications, you have to go to the website for Tarpeyo, just check everything on there, because I always believe in that. I always tell my patients, read about it. We have brochures, we have information about Tarpeyo, so I give it to my patients. I think it's really important as the patient to read up on the medication as well. This is a new medication. You want to know everything about it before starting taking the medication. So, 87% of the patients in the clinical trial study, they completed the 2-year study. So it shows that, usually in the clinical trials, because it's like clinical trials, they usually run for 2 years, 1 to 2 years. And it's really hard to keep track of all of those patients. A lot of patients, they stop treatment in between, or they have some side effects of the medication. But 87% is such a good number that it shows that a lot of these patients, they were tolerating the medication really well, and the side effects weren't that bad, that they continued the study for 2 years, and they came back for their blood test and their urine test like every time. So this is a good number. Like I always, like when I'm reading about clinical trials, I look at this number because I want to see that how well tolerated is the medication in general. Because if they tell me like 40% of the patients completed the treatment, I know that the medication is not getting like tolerated well, but 87% is such a good number. And then we mentioned about increase in blood pressure, which was small, and I see it in my clinic as well, that blood pressure goes up, but it's not something that makes you nervous about it. It's not something that we say that it's not manageable, and my patients, they don't have a lot of symptoms as well. So the increase in the blood pressure is going to be mild. And then A1C, for people that they have diabetes, the A1C was generally unchanged throughout the treatment. So you do not have to worry about your blood sugars that much when you are taking Tarpeyo. And I think that's really important because, diabetes is really common, and a lot of patients are dealing with diabetes as well. And having this fact that A1C was unchanged throughout the treatment, that's something that gives us a peace of mind that we don't have to worry too much about diabetes. And the weight gain, as I mentioned, the increase in the body weight was minor. It wasn't more than 2.2 pounds. And this is something that you should be able to return to your original weight within 3 months of ending the treatment. So you should be able to lose that weight, and it's not that much anyways. And I usually tell my patients that it's a good time to address your lifestyle as well. Try to exercise more, try to eat healthy as well, because it's going to help your kidneys as well, and it's going to help you to maintain your weight when you are taking Tarpeyo as well. So unlike other products, like for Tarpeyo, you do not have to do check your liver enzymes. You do not have to do pregnancy tests during this taking this medication. So it's not like, a medication that you take and then you have to come back so often to do labs. You get your prescription, and then next time that you need to do your blood works and your urine test is going to be in 3 to 4 months. So how do you take Tarpeyo? When I'm prescribing Tarpeyo, it's usually a 9 months treatment course, and it's a capsule. So you're going to take 4 capsules in the morning, and we want you to take it before breakfast, the first thing in the morning. So you wake up, you take your Tarpeyo at least 1 hour before your breakfast. Because as we said, this medication is going to go and sit on a special site of your gut, and that's the reason that it's related to the food, and we don't want you to take Tarpeyo with food. So take it first thing in the morning, at least 1 hour before a meal, and you do not crush, you do not chew, or you do not want to open the capsule. You just take the capsules, and do not take grapefruit juice with it, because there is an interaction between grapefruit juice and medication. And then, take it as prescribed. And once you're done with the treatment, in order to taper down the medication, we're going to go down to 2 capsules for 2 weeks, and then you're done with the treatment. So tapering down Tarpeyo, it's not that complicated as well. So as I said, the treatment course is usually 9 months. It could be longer sometimes. And then once you're ready to taper down, we're just going to go down to 2 capsules, and then for 2 weeks, and then you're done. You can stop taking the medication. So one thing is that it's really important, take it before breakfast, 1 hour before breakfast. And you don't want, if you forget taking it and then you want to take it next time, it's going to get mixed up. But at least you have to make sure that when you are taking it, it's at least 1 hour before a meal. So you don't want to take it with lunch or dinner. So you know what? The reason that we have this discussion today is that I want you to advocate for yourself. So I'm on the east side of LA, and I get a lot of referrals from the community. And a lot of my patients, even though that they've been diagnosed with IgA nephropathy, they do not know about these new treatment options. So they come to my clinic and I feel like, oh, okay, there is a disease that I have. It's called IgA, and there is no specific treatment for it. There is a specific treatment. And the more you know, the more you can advocate for yourself. And for example, you can go to your primary care doctor and say that I've heard that there is a new treatment for IgA nephropathy. Can I see a nephrologist? Or do you think if you can have more information on it, maybe you can help me to get Tarpeyo, because the more you advocate for yourself, it's just the truth. You're going to get more from the healthcare, and you're going to get more the options, because sometimes you're seeing the best physician and they are the best, but they just not be updated on IgA nephropathy, which is such an uncommon disease. And, your primary care doctor might not be updated on IgA nephropathy and might take months to see a nephrologist. So the more you know, you can have more options in, maybe you can have access to these medications much faster than other people. So I'm really happy that we are talking about this medication today, because this is something that can change the disease course and can help you in the future not to go on dialysis. This is huge, and this is something that everyone should advocate for themselves. This is something that we have a treatment out there, and we should know about it. And I want every patient to have access to this medication so we can preserve your kidney function. What are the things that you can start? What are the conversation starters that you can do that? Can we discuss a disease-specific treatment option like Tarpeyo? Based on my recent lab results, could Tarpeyo be an option for me? You can bring up Tarpeyo and see what your doctor thinks, and if they think that you are a good candidate for it. Or what results might I expect once I'm on Tarpeyo? Do you think that Tarpeyo is going to change my disease course? Do you think that it can affect, my health in general? Do you think it can save my kidneys over time or not? So how long will I need to take Tarpeyo? I've heard about this new medication, and I want to know, how long do I need to take it? What are the side effects? How is it going to help me? These are the things. These are really good questions that we all can ask our doctors in every situation. There are things that is not in my specialty as well, and the more you know, you can advocate for yourself and your family members. And that's the reason that I think that it's really important to have such these conversations. So Tarpeyo Touchpoints is a team of support that can navigate your treatment needs. They can navigate how prescription can be done. This is something that I do in my clinic. There's a specific form that we fill it out. We have to send it to a special pharmacy. So is this not a medication that your physician can just type it in on the system? You can actually send it to a special pharmacy, and then you order Tarpeyo, and they have a group that they help us. For example, if the insurance company is not able to cover it, they have a coverage plan that they actually provide the medication for my patients as a bridge until we can solve the issues with the insurance companies. So this is something that they can track your prescription shipments every month. And these are the helps that actual life. There is one point about prescribing the medication, and there is another thing about receiving the medication. And Touchpoints can help you to actually receive the medication. And yeah, as I said, they have financial programs, which I think that it's important. And I have a couple of patients that they use the bridge and, until we were able to solve the issues with the insurance company. So you do not have to wait, months in order to receive the medication. So these are the things that, again, are important to know on the patient side as well. So you can advocate for yourself and receive the medication as soon as possible. And this is how you can contact them. Yeah, so as we said, the indication and important safety information for Tarpeyo. Tarpeyo is the only FDA-approved medication for IgA nephropathy. This medication was studied for adult patients in IgA nephropathy, so we do not have the information for children at this time, and I'm sure that we're going to have more clinical trials in the future. And if you are allergic to budesonide, which is the actual substance in Tarpeyo, then you're not taking the medication. It's like any other medications. If you're allergic to it, then you're not going to be a good candidate for it. And always, always review the important safety information on the website just to make sure that you know about all the side effects before starting taking a new medication. And as we said, these are the safety information, and always tell your doctor about anything that has been going on in your past medical history. If you've had stomach ulcers in the past, if you had osteoporosis in the past, if you've had high blood pressure, like these are, if you have an active infection right now, or had chickenpox or measles, or you've been near someone who had chickenpox recently, these are the things that we need to know before starting Tarpeyo. If you have traveled outside United States recently and you stayed there for a long time and you think that you might have TB, tuberculosis, that's something that you need to discuss it with your physician as well. If you have history of diabetes, as we mentioned, Tarpeyo doesn't affect your A1C that much, but we want to know everything about your past medical history when we are starting a new medication. So always mention everything in your medical history and medical background when you're seeing a new doctor. I get a lot of referrals in my clinic because I have a subspecialty clinic for IgA nephropathy. And a lot of patients, when they come to my clinic, I don't have any information on them. I just know that they have IgA nephropathy. So we always go through everything, so every medications that they are taking, all the health issues, just to make sure that we are offering the best treatment options for them. Yeah, so these are how you take Tarpeyo. It's once a day. As we mentioned, it's going to be 1 hour before a meal, and you want to take it first thing in the morning. That's the best time to take the medication. If you have any side effects, if you feel like you're taking Tarpeyo and something new happening, always tell your physician right away. And if you miss a dose, just prescribe it at the next scheduled dose. So you do not want to take 2 doses at the same time. So for example, if you forget to take your Tarpeyo this morning, you do not want to double the dose, the next day because you missed the day. You just continue as the next scheduled time. This is the way that we don't want to cause toxicity as well. So as we said, there is an interaction between grapefruit juice and Tarpeyo. So eating grapefruit or drinking grapefruit juice can increase the level of Tarpeyo in your blood and can cause toxicity. So this is something that we always tell our patients. You have to be careful about that during the time that you are taking Tarpeyo. Tarpeyo can have, if you get Tarpeyo toxicity, it could be too much corticosteroids medicine in your blood, meaning that it's going to be a stress hormone. It can cause more acne for you. It can cause more weight gain. It can cause some swelling, and it can cause some fat pads around your shoulders. So these are the things that you might see if you take a lot of Tarpeyo. And Tarpeyo, substance, has some effects of corticosteroids anyway. So that's the reason that it's really important to make sure that you're not taking grapefruit juice with the Tarpeyo, or you're not doubling your dose, because we don't want to cause this kind of toxicity in your body. And then we talked about the possible side effects of Tarpeyo, but as we said, because the substance is like close to corticosteroids, it can cause some adrenal suppression, and it can cause like immunosuppression as well. So you have to be careful. You're going to be at risk of infections, and we always tell our patients that you might be more likely to get more infections. Avoid people that they have contagious diseases. Like, for example, if someone has chickenpox, even if you're not on Tarpeyo, you shouldn't be in contact with them all the time. So, but when you are taking Tarpeyo, you do not want to spend a lot of time with them. I always tell my patients, this is something not on the label, but I always tell my patients, if you're going somewhere that's really crowded, or if you feel like people are going to have flu or COVID-like symptoms, wear your mask and try to protect yourself. Use a hand sanitizer all the time. You're going to be at risk of infections. You have to be more careful, and because it's going to suppress your immune system. And then if you have any symptoms of infection, when you are taking Tarpeyo, always talk to your physician right away, because sometimes if you are having really high fever, or you're vomiting, you have severe nausea, we want to know as soon as possible so we can make adjustment to your prescription. And other side effects that we talked about it: acne, muscle spasms, high blood pressure. You can have some swelling on your legs. You can have some swelling on your face as well. Your weight might go up. You can have some indigestion. But all of the symptoms so far, in my experience, it's been mild to moderate, and you should be able to tolerate the side effects. As we said, based on the clinical trial as well, 87% of patients, they completed the treatment for 2 years. So it sounds like the side effects were they were able to tolerate that as well. If you have severe symptoms, like any of these symptoms are really severe for you, call your doctor right away, because we want to know about this. This is not something that we are expecting. And then Tarpeyo can help you to control your IgA nephropathy. As we said, that this is the first and only FDA-approved medication that is proven to help your IgA nephropathy, and it's proven to help to save your kidney function. It's only FDA-approved treatment designed to target a source. It's going to go to your gut. It's going to decrease the production of IgA1. So from the pathophysiology standpoint, it makes sense. And it's one of the medications that helps you to stop the process of IgA nephropathy before it gets to your kidneys. So it makes sense from the mechanism of action that should help with patients with IgA nephropathy. And we have the proven results over 2 years, and we have other patients who took this medication for 9 months, and they were followed up for a total of 2 months. It showed that it can preserve your kidney function, and it can reduce the amount of protein in your urine, which are 2 markers that we check when we are following up on our patients with IgA nephropathy. So you usually take the medication for 9 months, and it's 4 capsules once a day, and you want to take it before breakfast, first thing in the morning when you wake up. And we talked about Tarpeyo touch points, that is going to offer many programs, and it's going to help you to afford the medication. So now we have Katherine here. She is a patient who took Tarpeyo, and she is willing to share her experience with us. Thank you so much for being here, Katherine.
Thank you so much. Can you hear me okay? Good.
Yes.
So my name is Katherine. I'm 37 years old. I'm a deep space artist, originally from the UK. Spent many years in Australia, and now I'm living in Alabama. I was diagnosed with IgA nephropathy when I was 25. And I actually discovered it kind of by accident, because I was actually going for a visa medical, and they noticed my elevated protein and blood in my urine. So I went and got a kidney biopsy, and that was where I was officially diagnosed. But yeah, I remember being told I'd be on medication for the rest of my life, and I felt kind of overwhelmed because I guess I'd never been prescribed a lifelong medication before, and I was always being quite healthy up until this point. So anyway, and also finding out that even with that, there could be a possibility of needing dialysis or maybe a transplant later on, and that is honestly terrifying. So my nephrologist at the time started me on ACE inhibitors, and I was taking them for quite a while, but we weren't really seeing much of an improvement. We maxed out the dose. I changed my diet. I stopped eating quite a lot of stuff that I really liked. But even with all of that, I still had quite high protein and blood in my urine. It always kind of stayed the same. But anyway, so 2 years ago, I moved to the US, and I needed a new nephrologist, obviously. And honestly, I feel really lucky because I found a very highly regarded doctor, and he was telling me about this groundbreaking research paper on a new medication that had recently come out, and that the medication was designed to treat the gut area of the body that was thought to be the source of IgAN, which is really funny because until that point, I had like no idea that where IgAN proteins were made. And for 10 years, I had no idea that I was the one making them. So anyway, that was when he was told me about Tarpeyo. Now I'm the kind of person that likes to be well read on these things. So I went and looked up all the studies and reviewed them. Highly recommend everyone does it. And I thought they were really interesting. And in particular, I was very impressed with the long-term data. Yeah, I guess this is the first time I've seen a medication that was specific to my condition, and especially one that could potentially help long term. Anyway, I started Tarpeyo 6 months ago. Obviously, it is a 9-month course, so I'm a little past halfway. I've already seen a good reduction of protein and blood in my urine, and my kidney function has remained really consistent so far, which is awesome. And my doctor's very happy with my results. And honestly, I am stoked with the improvements. We're not even finished yet. So I'm excited to see in the next set of results. But yeah, anyway, this is the first time in a decade that I've taken medication that I've seen a result like this, which is very exciting. So as far as side effects, I had like light cramps in my legs in the morning, but that only really lasted for the first month or so. It kind of felt like, I guess, an adjustment phase. I don't know if everyone will get that or be the same, but it certainly was for me. Lately, I've noticed that my face is a little rounder, but I still think I look fine. But you know your own face. But fortunately, it's just a temporary thing, and I, expect it to go back to how it was once I finish my course. Yeah, in a few months, I'm going to be finishing my treatment, and I'm really excited for the next stage in my life. Yeah, the chance to create a future that I've always wanted. And it's a possibility that isn't terrifying, and I honestly couldn't ask for more. I'm really grateful I get to share my experience with Tarpeyo with you guys. Obviously, just remember that everyone is different, have different experiences, and you've got to do the right thing for you. But honestly, I'm very happy with my results so far, and I really hope everyone gets to experience that too.
That's amazing. Thanks so much for sharing your experience. I think it's really important to like share this kind of experiences because IgA is such an uncommon disease, and having this kind of community to share experience, it means a lot. And I think it helps patients, and you can choose, like which one is going to suit you the best and what option is going to be the best for you. Because as you said, every patient is just so different. And we have a lot of options now, and it's important to know about the options. So thank you so much. We have a couple of questions. Should I take the questions or?
We do have a couple of questions, Dr. Norouzi. Patient wants to know, can you tell the difference, or can you explain the difference between Tarpeyo and the typical corticosteroid treatment?
Yes, of course. So, a typical corticosteroid medication is that when you take the medication, it's going to get absorbed as soon as you take the medication. So you're going to have the systemic effects of corticosteroids with these medications. You're going to gain a lot of weight. The round face that Katherine was mentioning, with systemic corticosteroid, it's going to be more obvious. You're going to gain some weight on your shoulders. You're going to have increase in your blood pressure. You're going to be at risk of infections much higher than Tarpeyo, because this medication is going to get absorbed as soon as you take the medication. So it's not a targeted release medication, and it gets absorbed systematically. So you're going to have all of these side effects times much, much higher than like Tarpeyo. So Tarpeyo is a targeted release. So when you take the medication, it doesn't get released until it gets to that point of your gut that is making a lot of IgA1. So basically, we are hoping that this medication is going to have less side effects when you compare that to systemic corticosteroids. And it's not just hoping. Based on the clinical trial data, they had less side effects. For example, if you're taking systemic corticosteroids, you're going to have increased A1C, like your blood sugar is going to get affected right away. With Tarpeyo, we did not have that much of a change in A1C in our patients who took Tarpeyo in the clinical trial. Increase in the blood pressure with systemic corticosteroid is usually like really obvious, and you have to make a lot of adjustments to the medications. We had a clinical trial with corticosteroids on IgA nephropathy that is called testing trial. And the side effects that was reported on the testing trial were so high that they had to stop the clinical trial because of the side effects. So there were like severe infections that they couldn't complete the study because of that. So it shows that with systemic corticosteroids, you're just gonna have higher chances of having these side effects, and you have to be much more careful. So one good thing about Tarpeyo is that we feel like it has less side effects and it's going to work on your kidneys. So this is going to be a better option for the patients.
Do you recommend any specific diet to your patients when they're on Tarpeyo?
So as I said, I'm so pro, I'm in California, so I'm so pro like lifestyle modifications, like eating healthy, less salt. These are the things that actually helps your blood pressure, and it helps with the swelling on your legs. So I always tell them, my patients, this is the perfect time to make a lot of good adjustments to your lifestyle. Like try to exercise as much as possible, try to eat healthy. There is no specific restrictions or other than the grapefruit juice that I mentioned, because it has an interaction with the medication Tarpeyo. Otherwise, we just want you to eat healthy, and we want you to minimize the amount of salt that you are taking. The less salt is going to affect like your blood pressure in a better way, and it's going to help your kidney function as well. But not just because of Tarpeyo, just because of your kidney disease. In Tarpeyo, the only restriction is grapefruit.
And do you recommend Tarpeyo with an SGLT2 inhibitor as well?
Yes, of course. So SGLT2 inhibitors is one of the background therapies now, the same as the blood pressure medication that we mentioned, lisinopril or losartan. We do SGLT2 inhibitors for all of our patients. So most of my patients, they are on SGLT2 inhibitors. They are on a blood pressure medications that they call, like usually it's lisinopril or losartan here in the United States. And then we do Farxiga or Jardiance. Both of them are SGLT2 inhibitors, and you can pick one of them and take them once a day.
Great. And how long we have a patient wants to know how long will I need to take Tarpeyo?
So based on the clinical trial, patients, they took 9 months of Tarpeyo, and all of the results that we were talking about it was about taking Tarpeyo for 9 months. And then we tapered down Tarpeyo for 2 weeks. So they were taking 16 milligrams of Tarpeyo for 9 months, went down to 8 milligrams of Tarpeyo for 2 weeks, and then they were done. In real life, sometimes I have patients that they are responding to Tarpeyo really well. For example, we start with 2 grams of protein. At 9 months, we are at 900 milligrams of protein, or 1 gram of protein. Like it's going down, and it's amazing, but it's not there. I just want to see better results. So sometimes I continue it for a longer time. So I have patients that they've taken it for more than a year as well. And once I see that their protein is close to 0, at that time, I'm going to stop it. In the clinical trial, you're following a protocol, and you have to follow the protocol because you want to see, like, you are comparing patients that are taking Tarpeyo and patients who are not taking that. So you have to follow the protocol. In real life, patients are different. Sometimes you're responding to the medication a bit slower than other people, and you might need a longer time. And I think that's fine. As long as you're responding to the medication, I would continue that until I see the perfect results. And then at that time, I'm going to taper down.
And we have a patient who has been diagnosed with aggressive IgAN, and his nephrologist is very hesitant about using Tarpeyo. What kind of advice can you give our patients to let them know the type of conversations they need to have with their doctors about Tarpeyo?
I saw that comment, and you know what? I know that this is a complicated situation because we always kind of believe in our physicians, and I can tell you that just to get a second opinion. You do not have to fight with the physician because that's his opinion, and I think like just get a second opinion. This is an uncommon disease, and it's not like diabetes or, as I said, high blood pressure that they say that, oh, okay, this is something that my physician is seeing this IgA nephropathy every day in the office. This is an uncommon disease, and you need to get a second opinion, especially if you're not being seen at the glomerular disease clinic. I would make an appointment at a GN clinic, which is like a subspecialty clinic for IgA nephropathy, to to get a second opinion, because there are a lot of options. We talked about Tarpeyo today, but for IgA nephropathy, you have a lot of options, and corticosteroids is such an old medication now. So I really want you to talk to other doctors and see what they think. And you know what, maybe based on your blood works and maybe based on your situation and your health history and everything, maybe corticosteroid in some specific situation could be the choice. But you just need to get more opinions about this just to make sure, because we have a lot of more options with less side effects. And I want to make sure that you are receiving the right treatment.
Do you have any idea when Tarpeyo may be available in Canada?
I don't know. I think Dana should know about that. I know that it's getting more available like worldwide. I don't know the timeline.
Great. And we have a patient who's currently taking Tarpeyo 2 months into their treatment, and they're not seeing a change in their protein. Do you think that Tarpeyo is working for them, or?
Yeah, so that's the thing, like on the clinical trial, as I mentioned, like we have to be really patient with Tarpeyo. If you are taking Tarpeyo for 2 months, it's too early to check your blood works and urine tests. We usually check it at 4 months, and at that time we should see some improvement. And after 4 months, when we check it like at 6 months or 7 months, usually that's the point that I see a really good reduction in the amount of protein, and I see like better results at that time. So this medication doesn't work overnight. You have to take it for a while. And the reason is that this medication is working on decreasing the production of IgA1. So it takes time because you already have some IgA1 on your body. So you have to clear those, and then we're going to decrease the production of the IgA1 for the future, right? So it takes time to work, and you have to be patient with Tarpeyo. Check your labs in 2 months, and you should see some improvement, hopefully. We pray for you.
Thank you, Dr. Norouzi, for joining us, and Katherine, thank you as well. And thanks to Kalidi for sponsoring this webinar. And for those of you who are still navigating your IgAN journey, please visit www.igAN.org for some tips and on how to navigate that journey. And everybody have a good night. Thank you.
Thank you so much. Take care. Thanks for having me.